Spending somebody else's money. Part 1. Expenditure and non-expenditure transfer.
Wouldn't it be great if instead of spending your own money, you could spend somebody else's money? This may sound nice, but in the federal government, adding to or augmenting your appropriation has a bad rap. So before we go any further, let's talk about the augmentation concept. In Chapter 6 of the Red Book, The Principles of Federal Appropriations Law, GAO tells us, as a general proposition, an agency may not augment its appropriations from outside sources without specific statutory authority. When Congress makes an appropriation, it also is establishing an authorized program level. In other words, it's telling the agency that it cannot operate beyond the level that it can finance under its appropriation. To permit an agency to operate beyond this level with funds derived from some other source without specific congressional sanction would amount to a usurpation of the congressional prerogative. Restated, the objective of the rule against augmentation of appropriations is to prevent a government agency from undercutting the congressional power of the purse by circuitously exceeding the amount Congress has appropriated for that activity. To make sure that agencies do not undercut the power of the purse, Congress made it explicitly clear in a law passed in 1950 that funds cannot be transferred from one account to another without statutory authority. No funds made available under this or any other act shall be withdrawn from an appropriation for credit to another except as authorized by law. And this has been codified in Title 31 of the U.S. Code 1532. So, clearly, we cannot spend somebody else's money in the federal government unless, and this is a crucial point, Congress gives us permission. As you might have guessed from the title of this session, there are times when Congress does just that. We'll call these permissible augmentations. In this session, we'll focus on two types of permissible augmentations or ways to spend somebody else's money: the expenditure transfer and the non-expenditure transfer. We'll break the session down into two parts. In part 1, we'll define and distinguish these two types of transfer by first discussing examples of each. Then we'll talk about the different statutory authorities for each type. In part 2, we'll discuss the different ways we treat these two types of transfer in the SF-132 or apportionment, the SF-133 or report on budget execution, and the program and financing schedule in the President's budget. After our discussion of these two types of transfer, we'll wrap up with a couple of other possibilities for spending somebody else's money, but that do not require a transfer. So, what is a transfer? OMB provides a concise definition in Circular A11. A transfer moves budgetary resources from one budget account to another. An expenditure transfer involves an outlay, and a non-expenditure transfer doesn't involve an outlay. But what does that mean? Let's consider a simple example. Suppose your neighbor asks you to pick up a couple of items when you go grocery shopping. Let's assume the items cost $5. You spend $95 for your groceries, plus the $5 for the neighbor's items. That makes the total grocery bill $100. When your neighbor pays you the $5, that's an expenditure transfer. There's a transfer of resources from your neighbor to you, and that is a payment for some groceries. Notice that the $5 increases your resources, but you have to use those resources to provide $5 worth of groceries to your neighbor. Your net grocery bill is $95, $100 minus $5 for your neighbor's share. Your neighbor's grocery bill for this exchange is $5. There are a few points to take note of. Both you and your neighbor spent the $5. You received the $5 as an additional resource that covered the cost of the extra groceries and offset your total grocery bill. Your neighbor received something, the groceries, for the $5. The purpose or color of the funding did not change. You provided something your neighbor needed and were reimbursed for it. The color of the money does not change. What about a non-expenditure transfer? We know from its name that a non-expenditure transfer does not involve an expenditure or outlay. You might think of a non-expenditure transfer as a transfer of funds from one checking account into another. For example, suppose you have a child attending college and you need to add some money to their checking account. You could have your bank simply transfer the funds from your checking account to your child's checking account. This movement of funds decreases the amount of money in your checking account and increases your child's checking account. There's no payment for anything, and you receive nothing in return for the transfer. Note, in this case, you did not spend any money. You gave it away for someone else to spend. In a real sense, you transferred the authority to spend the money to someone else. Your account was reduced. The receiving account was increased. You received nothing in return. The original purpose of the funding changed. Now the money is to be used for the purposes of your child, and the color of the money changed. Now that we've had these simple examples, let's relate them to the federal government. Suppose Agency 1 needs to send a mailing out to the aging community, but does not have an infrastructure to do so. Agency 1 could enter into an agreement with Agency 2 to do this mailing, knowing they have the infrastructure to carry it out. Let's assume it costs $500,000 to do the mailing. Agency 1 signs an agreement, very similar to a contract, with Agency 2 to provide this service. Agency 1 obligates the $500,000 based on this agreement, and Agency 2 provides the service. In providing the service, Agency 2 also obligates $500,000, but collects the same amount from Agency 1 as payment for providing the service. The payment from Agency 1 is collected as an expenditure transfer because it's a payment for a good or service. Note the similarities with the grocery example. Both agencies had to obligate and pay the $500,000. Agency 2 collects the $500,000 from Agency 1, therefore offsetting its costs in providing the service. Agency 1 received a service for the $500,000. The purpose of the funding did not change. Agency 2 provided a service that Agency 1 needed and was reimbursed for it. The color of the money did not change. There are, however, a couple of differences that I should point out. The obligation by Agency 1 creates budget authority for Agency 2, called spending authority from offsetting collections, which Agency 2 can obligate in order to provide the mailing service. There is a requirement that the $500,000 be the full cost of providing the mailing service. If the mailing costs only $450,000, Agency 2 can only collect $450,000 from Agency 1. If the expenditure transfer, that is collection, happened to come from a non-federal source, the receiving account must have received the funds before they can treat it as a budgetary resource. How about the non-expenditure transfer? Similar to the example of transferring funds from your checking account to your child's, the federal government version of the non-expenditure transfer would be accomplished by moving funds from one Treasury account, called a Treasury Appropriation Fund Symbol, or TAFS, to another. This transfer reduces the budget authority of the giving account and increases the budget authority of the receiving account to carry out the purposes of the receiving account. We call it a non-expenditure transfer because there is no payment or expenditure involved for goods or services received, and nothing is expected in return. Suppose, for example, the Secretary transferred $1 million from one account, TAFS 1, to another account, TAFS 2. Looking at it graphically, the TAFS 1 account gives the TAFS 2 account $1 million of its budget authority. There is no obligation or outlay. And TAFS 1 gets nothing in return from TAFS 2. Note, in this case, TAFS 1 did not spend any money. It transferred the authority to spend $1 million to TAFS 2 to spend. TAFS 1 was reduced by $1 million. TAFS 2 was increased by $1 million. TAFS 1 received nothing in return. The original purpose of the funding changed. Money that was originally appropriated for TAFS 1 was used for purposes of TAFS 2. The color of the money changed. So, put simply, the basic difference between the two types of transfer is that expenditure transfer involves payment and non-expenditure transfer doesn't. But remember, we are forbidden to withdraw an amount from one appropriation and credit to another without some sort of statutory authority. So what does such authority look like? Let's take a look at some authorities for expenditure transfers. Recall that expenditure transfers create budget authority called spending authority from offsetting collections. For purposes of discussion, let's separate the two major types of spending authority from offsetting collections into reimbursements and revolving funds. Each of these authorities originates with Congress. Reimbursements are amounts collected for materials or services furnished. They are distinguished by whether they come from the public or from federal sources. Revolving funds are established by Congress to finance a cycle of business-like operations through amounts received by the fund. Such funds charge for the sale of products or services and use the proceeds to finance its spending, usually on a self-sustaining basis. They are also distinguished by whether they come from the public, called public enterprise, or from federal sources. Let's focus on reimbursements from the public. We'll discuss two types, user fees and other types of fees, like semi-postals. A good example of a reimbursement from the public is the user fee. A user fee is a fee assessed to users for goods or services provided by the federal government. They generally apply to programs that provide some sort of special benefit to identifiable recipients above and beyond what's normally available to the public. For example, a fee to enter a national park is considered a user fee, as is the fee you pay for a passport. Probably the best examples of user fees in HHS are in the Food and Drug Administration. There are user fees for prescription drugs, medical devices, human generic drugs, and so on. In this case, FDA gets to spend somebody else's money, the prescription drug, medical device, and generic drug industries, among others. Congress provides explicit permission to augment the FDA appropriation in the Annual Appropriations Act. Note that FDA provides a service for receiving the user fee, drug and medical device approvals, for example. Another example of user fees is the CDC Vessel Sanitation Program. Again, Congress provides authority in the Annual Appropriations Act. That program inspects cruise ships in an effort to prevent and control GI illnesses on cruise ships. CDC gets to spend the cruise ships company's money, but they provide an inspection service for it. An example of another type of fee the federal government's authorized to collect from the public is the semi-postal. A semi-postal stamp is a postage stamp authorized by Congress, issued to raise money for a particular purpose, like breast cancer research, and sold at a premium over the postal value. For example, the breast cancer stamp, which was first authorized in 1998 and has been reauthorized several times, has brought in over $80 million for breast cancer research. Now let's talk about intragovernmental reimbursements. What permissible augmentation authorities does Congress provide us for intragovernmental reimbursements? Well, let's take a look at some examples. PHS evaluation, the Stafford Act, and the Economy Act. Section 241 of the Public Health Service Act provides the authority to collect funds for evaluation of PHS programs, not to exceed 1% of amounts appropriated for programs authorized by that act. This authority, which is codified at 42 U.S.C. 238J, is further amended in the Labor HHS Education Appropriation Acts to permit up to 2.5% of amounts appropriated for programs authorized under the PHS Act to be used for evaluation of the implementation and effectiveness of those PHS programs. Under this authority, one agency pays another for program evaluation services. Here are some examples of the use of this authority. Here's the NIH National Institute of General Medical Sciences. The Office of the Secretary's General Departmental Management. And the Substance Abuse and Mental Health Services Administration's mental health account, which got to spend somebody else's money. Of course, with PHS evaluation funding, the somebody else is HHS. So this authority is a poster child for the old expression, robbing Peter to pay Paul. The Stafford Act is another example of permissible augmentation in authorizing legislation. In this case, FEMA can reimburse other federal agencies for providing services during emergencies like hurricanes, floods, etc. So this authority permits certain HHS accounts to spend FEMA's money. There are other specific authorities, but these two are probably the most often cited specific authorities in HHS. But what if one of these specific statutory authorities didn't cover the situation? For such cases, there is a generic augmentation authority that's very popular, called the Economy Act. The Economy Act was originally enacted in 1932 and is codified at 31 U.S.C. 1535. This act permits federal government agencies to purchase goods or services from other federal government agencies or other major organizational units within the same agency. The Economy Act requires that if an ordering agency has fixed year funding, that is either annual or multi-year, the amount obligated must be de-obligated to the extent the agency filling the order has not incurred obligations before the end of the period of availability. It's also important to note the requirement that agencies collect from the customers the actual cost of goods or services provided. If the providing agency collects more than it costs to provide the good or service, it's improperly augmenting its appropriation. If the providing agency collects less than it costs to provide the good or service, it's improperly augmenting the paying organization's appropriation. Now let's take a look at revolving funds. In addition to the above types of laws that allow a federal agency to use offsetting collections, Congress also enacts laws that establish revolving funds. Revolving funds are funds established by Congress to finance a cycle of business-like operations through amounts received by the fund. A revolving fund charges for the sale of products or services and uses the proceeds to finance its spending, usually on a self-sustaining basis. As with reimbursements, there are two major types of revolving funds: those collected from the public, called public enterprise funds, and intragovernmental revolving funds that operate within the federal government. Public enterprise funds include, among others, the FDA's revolving fund for certification of color additives and the HRSA Health Center's loan financing account. Examples of intragovernmental revolving funds include the HHS and NIH Service and Supply Funds and the CDC Working Capital Fund. Here is a sample authorization for the FDA revolving fund. And here's the authorization for the HHS and NIH Service and Supply Funds and the CDC Working Capital Fund. Note that the authorization for the CDC Working Capital Fund cites the Service and Supply Fund Authority at 42 U.S.C. 231. Before we move on to authorities for non-expenditure transfers, I should point out one more thing about the expenditure transfer. It is always used to shift budgetary resources between trust funds and general funds. For example, note the language in the CMS Program Management Appropriation to be transferred from the Federal Hospital Insurance Trust Fund and the Federal Supplementary Medical Insurance Trust Fund. Similar language appears in the Office of Medicare Hearings and Appeals account. Any other time that you see the word transfer in appropriation language, it typically means non-expenditure transfer. But when the funds move from a trust fund to a general fund account or vice versa, the expenditure transfer is always used. Now, let's take a look at some of the non-expenditure transfer authorities Congress has provided for HHS. Here's a non-expenditure transfer authority that arises in authorizing legislation. The Prevention and Public Health Fund authorizes funding to be transferred to other accounts for programs authorized by the Public Health Service Act. Most non-expenditure transfer authorities occur in our annual Appropriations Acts. Let's take a look at a sample. By the way, here's a tip. If you search for the word transfer in an Appropriation Act, excluding trust fund transfers mentioned earlier, you will typically find examples of non-expenditure transfers. Here's an example. ACL has authority to transfer funds to the Secretary of Agriculture for commodities. Section 206 in the general provisions provides the Secretary with the authority to transfer up to 1% of any discretionary appropriation to another appropriation, as long as that account isn't increased by more than 3%. Section 207 gives the Director of NIH authority to transfer funds between NIH accounts for HIV research. Section 214 gives the Centers for Disease Control and Prevention permission to transfer funds for individual learning accounts. You might also see language that authorizes a reorganization transfer, such as this language transferring the Health Education Assistance Loan Program from HHS to the Department of Education. Reorganization transfers may involve the transfer of new resources as well as unobligated balances. These are just a few examples of circumstances where HHS can permissively augment appropriations using a non-expenditure transfer. All of these examples transfer the authority to obligate funds from one Treasury account to a different Treasury account. So far, we've been discussing examples of the non-expenditure transfer of authority to obligate. There is, however, another type of non-expenditure transfer, which rather than transfer the authority to obligate to a different Treasury account, allocates the authority to obligate to a subsidiary or child account. We call this subsidiary or child account an allocation account. You might also hear these referred to as transfer appropriation accounts. The allocation of authority to obligate is made by a non-expenditure transfer from a parent account to a child account, each sharing the same 4-digit Treasury account. Let's take a look at an example. Although HHS received an appropriation for the Health Insurance Reform Implementation Fund, several other agencies had a role in carrying out this implementation. So allocation accounts were used. The parent account has a TAFS that begins with 75, indicating it belongs to HHS. Treasury assigned a 0119 Treasury account code. Since IRS, Labor, and OPM have roles in implementing the Affordable Care Act, allocation accounts were established for the implementation fund in order to provide funding to them. Note that each child account has the same 0119 Treasury account code. By adding each agency's code to the beginning of the HHS TAFs, 20 for IRS, 16 for Labor, and 24 for OPM, separate child accounts are established. Even though funds are transferred to each of these child accounts, for budget presentation purposes, all funding is reported under the main account, 0119. You can see evidence of this here. Note that the total amounts reported for the 0119 account in the President's budget are derived from the sum of the activity for the parent and child accounts. The total outlay figure of $170 million in the budget, for example, is made up of $134 million in the parent, $35 million in IRS, and the remainder in the remaining child accounts. An allocation account is also used for the Vaccines for Children program and CDC, which receives a non-expenditure transfer from the parent Medicaid appropriation. ACF provides TANF and child care funding to the Bureau of Indian Affairs in the Interior Department using allocation accounts. Typically, the authority for using non-expenditure transfers to establish allocation accounts is not explicit. Rather, it's implied by the legislation. Because of this, establishment of allocation accounts requires consultation with OMB and Treasury. Let's summarize what we've learned about expenditure and non-expenditure transfers so far by looking at Exhibit 20 from OMB Circular A11. First, we note the two types of non-expenditure transfers: the transfer of authority to obligate and the allocation of authority to obligate. The non-expenditure transfer carries out the purposes of the receiving account, another way of saying the money changes color. The budgetary treatment of the transfer of authority to obligate results in a decrease to the transferring account and an increase to the receiving account. We'll say a bit more about this when we get to budgetary treatment. The allocation of authority to obligate carries out the purposes of the parent account, and the budgetary treatment simply results in the consolidation of reporting in the parent account. Expenditure transfer payments between two federal funds or accounts, or between two trust funds, are, in contrast to the non-expenditure transfers, payments to carry out the purposes of the paying account. Here, the budget treatment indicates that obligations and outlays are reported by the paying account, and offsetting collections are reported by the receiving account. Payments between federal trust fund accounts are always expenditure transfers, and the budget treatment is the same as other expenditure accounts. So, let's use this table from Section 20 of OMB Circular A11 as a quick quiz. If the transfer purchases goods or services that benefit the transferring account, which type of transfer is it? It's an expenditure transfer. If the transfer shifts budgetary resources between federal funds and trust funds, which type? Expenditure transfer. If the transfer reduces budgetary resources available for the activities of the transferring account and increases them for the activities of the receiving account, it's a non-expenditure transfer. And finally, if the transfer corresponds to a transfer of an activity from one account to another, it's a non-expenditure transfer.
End of part 1. Now you're ready for part 2.